So my name is Willyanne. But I have white skin, brown hair, brown eyes, and I'm currently wearing a gray jacket. And one thing before we went on, I'm just actually quickly, I have to give a quick disclaimer so that the opinions I present here are my own. So I just wanted to give you, I was really kind of inspired by the sharing of stories today, and particularly by the slide that Dr. Andrews shared that showed kind of, she had the chart where it said neutral in the middle, and then she had kind of the positive and negative. And on the positive, she had this part about power. And just before I had lived the experience of my own disability, I was in high school, I was a sophomore in high school, and I was captain of the swim team. And back then, you had to take in high school, and I think it's still true, you have to take swimming lessons to graduate from high school. But as it turned out, the school, in all of their benevolence, didn't provide swimming lessons for people with disabilities. They excused them from swimming lessons as if, you know, the danger of water was not applicable to everybody else. And I had, so some folks in the community we were very lucky because we had a very big pool, but we also had an additional pool that had a ramp, and it was heated and shallow. And some people in the community came up and said, we'd really like to do swim therapy and swim lessons on the weekends for people with disabilities. How about we get, you know, some of your friends on swim team together to engage this and get the school involved? I said, I can't do that. I'm not very popular. No one talks to me. Back then I was in Data Walk in high school, and in this group, everybody's like, yay! But back then in high school, it's not very encouraging to be a total brain. So, but, we got together and, talked to the school and the town, and we ended up having something like 40 different swim team members on the men's and women's team, and we got together with the disability community, and we had, I think, about 60 to 80 people in the disability community that were doing all different kinds of swimming and really teaching us how to learn about different ways to be safe in the water. And that, I just am really thankful for that sharing from the disability community of how to be an advocate and how to use your power and your voice. And later, when I graduated college, I was working in Boston as a lifeguard, like my third job to try and make rent in Boston. And I don't know if you know Rick Hoyt, but he did marathons with his father. He's very famous in the Boston area. He's done over 1,000 races. He had cerebral palsy, and I don't know how he found me, but he came to the Y one night and asked if I could help him with water therapy. And what he wanted was, it really helped him to go to the bottom of the pool because of the pressure, helped his lungs. And he said, I'd like to go down to the bottom of the pool for an hour, and go down for 6 minutes at a time and go back up. And he didn't have mobility in his arms or legs, and he didn't have verbal communication. And I said, I can't do that. How I can't possibly do that. He said, of course you can. This is something that we can do together. And gradually together, we both got 1 minute, 2 minutes, 3 minutes down. We worked up to 6 minutes, and we really learned how to communicate together. And then we built more and more people started coming, and it was a bigger program. And in the end, so how I developed a disability, one of my offices had aspergillus mold in the walls, and we didn't know. And several of us ended up in the hospital, and I ended up with very severe lung dysfunction, which I still have, severe asthma and other things. And I lived that experience of my employer all of a sudden going from being a fantastic standout employee to being a slacker and, not a needy and all of these things, because I asked for accommodations not to have to, to work from home, not to have to bring my oxygen tank, But that lung capacity that I had developed during that training actually helped save my life from this exposure. So I think all of this learning to say that might be too hard, or, I think it's really shaped my life a lot. So just say going forward. I wanted to just give a quick background on the MRCT Center. So our mission, we work across all of the clinical research spectrum, whether it's universities, pharmaceuticals, regulators. We bring everybody together, try and understand what are the challenges in clinical research, and then we develop tools and other things that we try and make very practical. I'm not going to go back over this because others have presented it so well, but just to say that I want to bring up this point again that Bonnie Lynn brought up about the intersectionality. We work a lot in diversity, equity, and inclusion, and for example, the diversity action plans that the federal government now requires for all phase 3 and later trials initially had a focus only on race and ethnicity. We've really kind of been, pushing back on that, and where we've gotten the greatest traction is to say, look, 30 to 40% of people in the United States who are people of color have a disability. We're not going to be able to reach them with trying to gear all of your initiatives, on greater inclusion, unless you pay attention to disability accessibility. So one of the things that we did, we recently last year launched this Accessibility by Design toolkit. The reason we did that was I had thought there was going to be lots of resources out there for clinical researchers on inclusivity, and what we found were there's some really good tools, especially in the education space. But a lot of them were very tailored, like how do you do web design, or how do you do like one specific thing. So we just got together. Thankfully, I had there's a great group of people with disabilities who we all work together to develop this sort of one-stop shop toolkit. So this is kind of the link and the, what's it called, the QR code for it. Right now it's just a PDF, and we're hoping to make it more accessible like the web. And just to say, we went through, so it has 5 themes: general considerations, communication accessibility, physical accessibility, newer strategies for inclusion, and that's really around things like, how do you get the IRBs to kind of take this up and start to think about how they're going to implement that, and accountability and advocacy. And for general considerations, I think you mentioned, our number 1 point is always at the outset, include people with disabilities, not just on research. Targeting people with disabilities in all research. Get people with disabilities involved from the get-go, on the IRBs, everywhere else. So I'm sorry the part of the slide is difficult to see, but I just wanted to show you sort of what some of the first section of the toolkit has key points in each of those areas I talked about before. What we ended up doing was some of the feedback we got from especially some people would say, oh my gosh, this is overwhelming. There's just too much to do. We don't know where to start. So we color-coded these into green circle for easy, blue square for moderate, and black diamond for advanced, sort of like skiing or adaptive skiing color scheme. We were hesitant to do this at first because we thought, well, everything is important. Like, how do we grade this? But we wanted people to be able to jump in and not be kind of push it back. So this just kind of shows you, this is from the communication part of the toolkit, and I'm going to go into this in more detail. So I'm going to talk a little bit about communication accessibility. All of these different things are important, but these are just a few that I pulled out. So you'll see in the green circle, we say things like use appropriate font. So we say, what the standards are. So for large print, you need a minimum of 12-point font for body text and documents, 20-point font for closed captions, and 24-point font for PowerPoints. We also say to use icons or graphics that don't require a lot of abstract thinking. A lot of the new sort of modern icons are these very abstract icons, and when you look at it, kind of like, what does it actually mean? It's usually like a circle with dots and like data representation. Alt text, which I'll talk about in a minute, and color contrast. And one thing that I've been talking about a lot with people is to refrain from animation and visuals that are flashing, pop-ups, audio play, things like that. Even our own comms team developed our annual report website and had this spinning globe and all these like things. So, oh, it looks amazing, but tone it down a little bit. So I'm just going to go through this very quick. What I wanted more is that you would have the slides. And I thought it was interesting that Peter was talking about alt text, because this may be very basic, like really basic. Maybe everybody knows this, but I constantly get asked, oh my gosh, how do I do alt text? Like, it's so complicated. And the same thing with color contrast. So this is how you do it on a PC, and I'm sorry, I don't have a Mac, so I don't really know how to do it on a Mac. But there's different ways to do alt text. So you can just right-click with your mouse when you're on a picture, and you can see the one kind of behind this drop-down list of the person using the type-to-text thing. So you right-click on it, it drops down a menu, you click View Alt Text, and then you can go on the next slide. There's a different way to do it. If you're in PowerPoint, you can go to Review at the top, check Accessibility, go to Alt Text, which you can see, circle on the slide, and then there's an alt text box that pops up, which you love so much, and you type in your alt text. So you want to enter in a brief description of what the image is. And just one quick thing about that is that the alt text should convey the meaning of the image. So you don't want to say this is a picture of a scale. You want to say why, basically, you're using that picture of the scale, what it's representing, the concept in your PowerPoint. So the next thing, I'm just quickly, again, going to post this up about color contrast. And so color contrast, this on the screen, what you see in the background is from the key point summary page in the Accessibility by Design toolkit. And what that is it takes kind of the categories that we have within each of those, like the subcategories within general considerations and inclusion and accessibility. And each category was color-coded, and we took to have the black text on the foreground, what we did is we made the color transparent in the background. This really tripped me up when I was trying to create this slide, so I'll show you again. So what you can do to do the color contrast is you click on the box, and then it'll click on the fill, and you pick your fill color so you figure out what color this is. You need to know what color it is by the computer code, which is the hex code you see in that color box. There's a little hashtag and a color code number. You have the transparency code. And then you can go to one of these websites, like the WCAG, you put in the hex code, and you can see, it'll tell you on the left-hand side, if that combination is readable. Okay, I did that. It was great. But then mine had a transparency level on it. I didn't know where to put that. And so I went in, and it turns out you have to go into this little box, into the drop-down menus that are circled in red, or lightness, and you have to put transparency. So I just threw these on here so that people would have them in case you have ever had a challenge doing color contrast before. But it's something that I didn't initially do often in PowerPoints, and now it's becoming much more routine. But people come all the time and ask about this, like, how do we do it? So I just decided I'd put it up there. The last thing was, one thing that you can do with PowerPoint slides that I didn't actually know about. I knew about closed captioning in Zoom webinars, but one thing that you can do is that you can click on slideshow and then subtitle settings, and you can click always use subtitles, and it will cause your PowerPoint to have subtitles on it always. So, moving into a couple other topics that we wanted to touch base on. I wanted to talk like others about eligibility criteria in clinical trials. So we did a study last year where, as Marilyn had said, there's not really great data collection that says how many people have disabilities in clinical trials. So we kind of did a backdoor, and we looked at the eligibility criteria and tried to see how many study protocols excluded people with disabilities. So one of the things that we found was 85% of the studies allowed for investigator discretion to exclude people, which is pretty typical across clinical trial protocols. However, we talked a lot about ableism. So then you have a young person often who's doing the screening for a study, They have something that says investigator discretion allowed as they're screening people for eligibility, and that can, the background and the opinions of the person demonstrating can get like prohibitive. So there were many, many exclusions in there, and I'll show you a chart on the next slide. Only 24% of the exclusions had any justification. So not for scientific reasons, no justification at all. And the justifications that were listed were incredibly broad enough to drive a truck through. Like, the person may not be capable of finishing the trial, or the person may confound the study results. Well, that could be anybody. And just, we didn't have this on the slide about, even in cases where the study should involve people with disabilities, for example, people with Down syndrome, something like, I think 80 to 90% develop Alzheimer's, early stage Alzheimer's, yet they are excluded from clinical trial studies on Alzheimer's disease. So one of the things we talk about a lot is that you need to revise eligibility criteria and make sure that you provide justification, scientific justification for the eligibility criteria. And expect to provide reasonable accommodations and state that they will be clearly available. I think her presentation was especially important to say that you also have to think about your outcome measures, and your instruments that you're going to be using, because those are very important. And the language, walking, for example. So just a few things on breaking news. Katie will talk about this later, Research for All. We've been really talking a lot more about supported decision-making, which is a method where people who have cognitive and intellectual disabilities, or really anybody who wants support making decisions, can have a supporter to help them communicate their decisions. The supporter is not making the decision for them, they're communicating the decision. Another thing I've been really pushing a lot lately is that, I'm going to skip over this one about capacity assessment, but decentralized trials. Everyone is pushing for faster trials, decentralized trials. I think we talked about ones at home. However, how is that impacting people with disabilities? You have a trial, for example, that's using an app. Everything is like app-based. Is that app accessible? Is it accessible beyond the first page of the app? Is the help desk accessible? You've got lots and lots of different ways, and on the screen I'm showing you a picture of a mobile site. So this site happens to have a ramp, but for example, I had to go in for monoclonal antibodies. I went to the site that was a mobile unit. It had no ramp. It was in the middle of a parking lot, very difficult to get to, and you go inside and there is no space. If you were using a wheelchair, you could not negotiate that space at all. So there's a lot to think about in decentralized trials, and this that's been coming up with, I think it's the NIH, about accessible equipment is one opportunity to talk about that. And then these are just the last few things about data collection. Incredibly important. We put that in when I was working initially with the US government on the President's Action Plan on Children in Diversity. We initially we're not collecting any data on disability. I pushed really hard to have that included. It was only on malnutrition, HIV status, and at the time they said there's no good data collection on disability. We said, great, well let's start working with, we started the Washington group and all these others. We're going to get the data, methods, even if it's imperfect. Get it going. As I mentioned before, financial neutrality for people with disabilities. And then I think one thing in clinical research that's been a challenge is I think people need more guidance on what reasonable accommodations are when you have different kinds of sites with different levels of resources. We're always told that you need to provide reasonable accommodations, but what does that mean? What are the basics that you need to provide? And especially if you are a low resource site, if you're a decentralized site, what are these kind of commonalities and how can you share resources? If there's equipment at one site, can those be utilized by other sites? I think there's a lot to work out there still. So thank you very much.